Welcome to our Medicare Advantage Outpatient Services, or Part B, Training Tips video series for skilled nursing facilities. In this segment, we will be exploring documentation needs for Part B requests. Let's start by addressing the question, what is needed from the provider or facility to request an outpatient or Part B authorization? There can actually be distinct variations depending on the insurance plan, the member's specific policy, and whether the provider or facility is in-network. Typically, for initial outpatient or Part B therapy requests, you'll simply complete the evaluation and plan of care to get started. Most Medicare Advantage plans do not require prior authorization for the evaluation itself, but it's always best to confirm with your authorization specialists. One exception to note is that WellCare does require prior authorization for evaluation codes. Now we can focus on additional visit requests specifically. At MNS, we send friendly update reminders when you're nearing the end of your current authorization. Our goal is to ensure the patient is receiving the services they need and that the facility is reimbursed correctly for their services as well. When more visits are merited, we'll request a progress note or an updated plan of care, depending on the insurance requirements. If the initial plan of care is still active, a progress note will typically suffice, but if the plan of care has expired, you'll need to submit a recertification or updated plan of care instead. Keep in mind that daily notes alone are not enough to request additional visits. Your care coordinator will let you know exactly what's required when they reach out about your update. Additionally, some payers will ask for daily notes along with your progress notes or updated plan of care. Another question that should be answered is, what if you have a patient who received a notice of Medicare non-coverage but still needs continued services under their Part B benefit? This situation can involve several factors. First, check your therapy corporation's requirements for payor changes. Many therapy organizations require a brand new plan of care whenever the payor changes. Second, determine whether the skilled payor requires a discharge summary. If so, you'll need to discharge the patient and then complete a new evaluation. In most cases, though, a recertification is enough to request Part B therapy following a skilled episode. What is the main exception to consider at this point? An HMO policy with out-of-network providers and managed Medicaid policies that bill therapy services separately. When in doubt, always verify your payor requirements, check your facility's protocol, and reach out to your care coordinator. These steps help ensure seamless coverage and timely reimbursement for all therapy services. At MNS, we don't just consult, we partner. If you are struggling with any part of the Medicare Advantage process, our experts are ready to provide real support with real results. In fact, our clinical team recently identified over $10 million in missing Part B therapy service charges for some of our skilled nursing facility partners. Contact us today to receive tailored solutions designed to meet your exact facility's needs at scale. MNS Clinical Solutions. Simplify managed care.